Hello, Haley.
Emma Worsley is only 2 years out of nursing school, and the pandemic is changing how she treats her patients.
They're by themselves, so you have to be there for them in a whole different way to just talk to them.
Both Worsley's parents were nurses, and she watched as they developed relationships with their patients. It's something that's now difficult with strict hospital safety rules.
You have to make an effort to be there, not just physically and passing their meds and doing their assessments. You have to be there, emotionally too, to be able to ask them, how are you doing? How's your family doing? Because a lot of these people, they have family that's either sick at home or sick in the ICU, and they're worried about them too.
The emotional toll is making an impact on nurses as well. Before the pandemic, an average of 18% of nurses showed signs of depression and anxiety. Since the pandemic began, that number shot up to 50%.
Everything changed in March.
Susan Hartmeyer just retired after working as a nurse for 33 years. She worked through the HIV pandemic in the 80s and later the Ebola virus. But she says the last 10 months of her career were a nightmare.
I've seen a lot of death over the years, but with COVID, there was literally nothing that was working for these people. And they're just dying and dying and dying.
Hartmeyer says hospital safety protocols would change weekly as staff tried to juggle treatment with little to no information about the virus.
People really didn't know fully at the time how A, deadly it was, and B, how transmissible it was.
For Emma Worsley, she's hopeful that as more Americans are vaccinated, the strain on hospitals and her fellow nurses will decrease. But when that will happen is still up in the air.
Just the uncertainty that you can't give these patients the answers that they're looking for, because nobody really has a definite answer. Nobody can say when this will end. We just don't know.